to another edition of Dash Town, where we focus on Fuquay-Varina centered businesses. And one that I'd like to highlight is Arosa. They help to provide the care that is often needed. When you think about, well, who's going to take care of me health-wise, medically? Who's going to take care of my spouse, my husband, my wife? Who's going to help me with the day-to-day tasks? Who might ultimately take care of mom or dad? You have to turn to a resource. You have to figure that out. And Arosa helps in that effort, not only helping to find the care, but then provide the care. Correct?
Absolutely.
All right. And with me today from Arosa, we have Barbara Patterson and Meike, didn't catch Weist.
Yeah.
Meike Weist, and name tags are here, but
Yep.
Meike, your name is spelled differently than it is pronounced.
Yeah.
So
True.
yeah,
Very
right off the
true.
bat, there was that we got Richon, who can pronounce that either. So tell me a little bit about Arosa and the services that you provide, just from a high level, please.
Absolutely. So Arosa is an integrated care management company. We've been around for 25 years, and we like to think of ourselves as a one-stop shop. We really can help you anywhere along your aging journey. We do home care, which is the one-on-one, and it's everything from companionship and driving. That's what a lot of people need first, to keep them mobile and social and out doing the things they love and enjoy, on up to full hands-on care. We are able to do nursing. So a really big service there is medication management. People overdose, underdose, don't take the right pills. We love to hang on to those old bottles that the names changed. We went from generic to,
Yep.
So we can help sort all of that out, keep them on the right medicine regime to keep them home and healthy.
Yeah, that alone can
Yes.
cause a lot of complications.
And then I think one of our greatest services is care management. And it's also probably one of the most complicated and misunderstood.
Okay.
Which is where this lovely lady comes in with all of her expertise. But through our care management, we can help with everything from A to Z. We are private pay, so that kind of makes us different.
Yep.
Insurance does not cover a lot, so we're not bound by their limitations.
Yeah.
So
Which is, I think I've seen the direction that a lot of the medical world seems to be heading is people don't love that their care is dictated through the insurance companies, and the care providers are handcuffed when that happens.
Absolutely. Absolutely.
Well,
so one-stop shopping for whatever you need.
So we'll come back to all the services, break them down one by one, cost, who, what, when, where, but certified care management. I want to talk about that because you gave me a couple numbers before we got started, Meike, that were shocking to me. And you are a certified care provider, management provider. Give me the title again. Sorry.
Let's throw my names around, or my acronyms.
Acronyms, yes, please. We love them.
Well, so I'm a master social worker by trade, and care managers can have all kinds of different backgrounds. And then I'm a certified care manager. There are more care managers. On top of that, I'm a certified national guardian, and that's the one we chatted about that is very limited. There's only 55 nationally certified guardians and only 5 here in North Carolina. So
that is shockingly low to me. Like with the prevalence, the number of aging seniors that we have, like that feels like we're grossly underserved in that area. And I think we are anyway, right? Space and care is very limited.
Yeah, that's true. I think in all aspects of care, there's a shortage and there's a need for growth, and especially with that section of the, of the population growing and continuing to grow into the future. I think there's going to be a lot of growth opportunity for what we do and a lot of need for more qualified professionals.
And Barbara told me that this has been a lifelong career and pursuit for you, that you've been doing this for a very long time.
I started in high school as a caregiver. So I was a caregiver that worked for a home care company, and I provided direct care to seniors in their homes and really enjoyed and found that I loved working with that older generation. I was going to school for social work at the time and thought I was going to work with children. But then through this part-time job, working in senior care for the 8 years that I went to school made me realize that I wanted to pivot and really focus on the aging population, and also adults with disabilities. And so I'm from Germany originally. That's why I
Or the
have
name.
that's where the strange name comes from. But moved here after I got my master's in social work and worked for Medicaid for a long, long time in care management and loved it. But like you said, whenever there's insurance money involved, you're very much limited to your box and to your, piece of the pie, and you don't really work holistically the way that I enjoy. And so when Medicaid at the time reshuffled things like they tend to do and are currently doing again,
Often, yes,
yes,
yeah.
that care management service was struck from the service array at the time. And so I was recruited to come into the world of private care management and found that I really love it. And I've been doing it for 12 years. And while social workers, I think, being do-gooders at heart and not really wanting to charge people for what we do, I found that that private pay component really allows me to work in a person-centered, holistic way that truly, meets the client's needs. So,
Well, it is a valuable service, so certainly justified that the people providing it do get compensated for it. But the question of cost is often a big one
yeah,
for families, and unfortunately sometimes prohibitive in getting the kind of care that we would want or expect. And y'all help people navigate that complex system.
yeah, and it really is very complicated. I think we're fortunate that we're living in an area that's very dense in resources for seniors and their families. But it's also really confusing. You start Googling and you just kind of get overwhelmed and close your laptop because you don't even know which is the right route for
Yeah.
you.
Well, and at 65, I think everybody knows, well, I get Medicare, and there's this perception that that means free health care for life. I don't have to worry about it anymore. And that really couldn't be further from the truth. Not only is it not free, but there's a lot of limits on what it actually does cover. And then you get the balance of Medicare and Medicaid, and people don't really know which
Yes.
one is going to cover what.
Yes.
And y'all live in a world that for a great amount of the services isn't covered by either.
Right.
Right.
Unfortunately, that's true. But, there are still great resources out there. And even though people might pay us a fee for our service, we can still determine, what public benefits may you be eligible for.
Which can
And
help offset some of that
yeah,
cost.
and also, if not, why not? To kind of just educate. And then too, are there other free resources and programs that you might be eligible for, such as respite programs? We are a referral partner for many of the local respite voucher programs or VA services. Arosa has a contract with the VA to provide, some VA funded services, as well as a program called Wake Independence at Home. So whenever there are partnership opportunities where we can provide some services to lower income seniors, we certainly try to do that too.
And I would like to add too, we can work within a person's budget. You hear the hourly rate and people may panic,
Mhm.
but spending $300 or $400 for a couple of hours of really good planning, well, you're a planner, you know
Mhm.
this, can make a world of difference and cost as you're back and forth to the hospital and loss of work.
Yeah.
The impact can be huge. And so you can budget with us. If you say, hey, I can afford $300, we'll give you everything we can
Yeah.
to help you.
And arranging what gets done in that limited amount of time,
Absolutely.
and the rides, places.
Yes.
You mentioned medication management. I know this is a big one, that people lose track of things. You see those pill counters and sorters, and they got the Monday through Sunday, the days of the week on them. But even that is a task that at a certain point in time can overwhelm people. They get confused, leading to bigger problems when they're not properly medicating themselves. And just assistance with daily tasks, transportation, travel, eating, bathing, getting up and down. Like
Absolutely.
those are things that across the different levels of service that you can help with, you can perform.
Absolutely. And I think that is the integrated care, is having the care manager, having the people who help with the resources and the planning. We've got the caregivers. So yes, getting up in the morning, having a shower, getting fresh clothes on, having food, that is super important. But you also need quality of life. And that's where I think our care managers come in. What brings you joy?
Mm-hmm.
And how can we help get that joy back into your life? And maybe it's not at the same level it was 20 years ago, but what can we incorporate in your plan to bring you happiness and joy.
Well, helping people with that, I'm sure, provides some satisfaction for y'all as well. That's why you're in the business. Same for the type of planning that I do. I want to help people live life to the fullest they can, but plan to be able to do that 20, 30, 40 years in the future as well, that balance there. But without, I'm not going to ask you to share the specifics of any individual situations, but can you think of some scenarios or examples where you were able to provide somebody some assistance and that filled your cup as well?
Oh,
I know she has thousands of stories.
yeah, those are the things that make this job so fun, because we do get to work in a really holistic way. So yes, I will coordinate somebody's doctor's appointments. I'll make sure their prescriptions get filled. I'll advise them on how to get a pre-need burial arrangement, but those things don't necessarily bring me joy. But for example, recently, one of my clients who's a younger individual with disabilities really wanted to participate in sports, this particular volleyball. And so we got him to play volleyball in a rec league for people with disabilities, and I got to go to one of his big tournaments, and it was just such a joy to see him participate in that. Or we have some of our seniors that attend memory cafes. And so on Friday, I got to attend one of those memory cafes and sit with some of the participants and draw and chat and just interact and see how important it is to have that engagement and to be part of a group and to feel like you are, participating.
Yeah. You mentioned the younger individual, and I think that's important because we think of like long-term care needs, or the kind of assistance that we're talking about here that you all can help coordinate and provide. We tend to think of seniors and even the upper end of senior,
Yeah.
but that's not necessarily exclusive. There are people of all ages that require some level of assistance, and sometimes families can't provide it themselves.
What we have found is that a lot of seniors that we work with are caregivers themselves for children with adults with disabilities. So, for example, one of my clients that I've worked with is in her 80s, and she has a daughter in her 50s that has Down syndrome. So all her life, she really was the care manager in a way for her daughter, providing everything that she needs. And that is such a source of worry, for those parents that are aging, to know I'm not going to be here forever. Who is going to do all these things? And not just who's going to make sure my daughter has a place to live, it's also who's going to make sure she has clean clothes and gets to go get her.
Okay, the wonders of technology and a little bit of technical difficulties there, but we are back here talking with Meike Weist and Barbara Patterson of Arosa. And providing care is the topic of conversation. Who needs that care? How does it get provided? Who's going to provide it? And sorry about the technical difficulties, lady. But we were sort of just wrapping up some final thoughts here. And Barbara, you had expressed kind of some thoughts of yours on, and stats to back it up, on the healthy spouse providing the care, and how sometimes that is even more difficult on the one providing the care than it is the one needing the care.
Absolutely. The statistics are, and we see husband and wives a lot, and they feel like it's their responsibility. To death do we part. It's my responsibility. And more than 50% of the time, it's probably closer to 60, the healthy spouse will pass away before the quote sick spouse, because they're not taking care of themselves. They're not going to their doctor's appointments. They're carrying all that stress, the extra load, doing both of their responsibilities to keep the house going. And that's a staggering statistic. People think it's a sign of weakness. I don't want to need care. In my world, it is a sign of power and strength. Bring somebody in. Let us help with some of those tasks and take some of that burden off of you.
Yeah.
And I'll say this too, when you're the spouse, it's time to eat. You didn't eat enough food. You need to drink more water. I become your nag instead of your spouse. So let us come in and be the nag, and you just be the spouse and enjoy the time with your loved one and do the things that y'all used to love to do. If that's reading a book or talking about what's going on in the world or watching a movie or sitting outside, let us do the bed linens and wash the dishes and fuss at the person who needs to be drinking more fluids.
Yeah. Because it's, I mean, physical, emotional, mental stress, and stress is harmful for us, and certainly the caregiver needs care and support as
Yes.
much and very often as well. And you said, Micah, that it's not always just spouses, children
Yeah,
too.
I think the adult children, for them, it can be especially hard too. You have that obligation and that feeling of wanting to help your elder, but oftentimes, you know, adult children still work, they have children, they have lives of their own that they need to tend to. So it can be really a stressor on that relationship. Plus, you know, it's difficult sometimes for the parent to receive guidance or directives from an adult child, and it's not always very well received. So it puts kind of a unique shift on that relational dynamic. So I think that's sometimes where care managers can come in and not only guide the caregiving adult child and help them in their role, but to also mediate that relationship a little bit and maybe, you know, be the voice of reason. Sometimes information and guidance is received very differently from a professional than it might be from the daughter. You know, dad might not want to be told that he can no longer drive,
Yeah.
or you know, that he might not be safe at home, or that he might need to have somebody there 12 hours of the day. So having, you know, that professional be that bridge can be really helpful, and let the children be the children and not
Yep.
the,
Yeah. We're seeing a lot of generational
yeah,
caregiving requirements, though, a lot of pressures. And I think the dynamic of that relationship, you're right, can be stressed and strained in both ways, as kids take care of parents, as parents have to allow their kids.
yeah,
If you've changed somebody's diaper, it's hard to take direction from them. You
Yes.
know, for parents that did that for kids one day, they don't want to hear their opinion on,
Even
you
if their
know.
kid's a doctor, it
Yeah,
doesn't
yeah, it
matter.
doesn't matter, right? All right.
it really doesn't. And you know, I think too, not everybody has that family. So that's the
Yeah.
other, you know,
Yes.
the other side of the coin is that, you know, a lot of times either there is no family, or people say, well, I always thought my daughter or my son would be here to do these things, but now they live in Japan, or, you know, they took a job in
Yeah.
Boston, and so they can't be here to do those things. So for us to step into the gap is, you know, what we like to do.
We also see too the dynamic of people being scared to have the hard conversations.
Sure.
And so I think that's really where a care manager can step in as well. We
Somebody
can
not
facilitate
partisan,
it.
not involved, yeah,
Yes.
absolutely.
Yeah.
Well, Meike Weist, Barbara Patterson from Arosa, thank you very much. And one more time, what is the website people can find out more?
It is www.arosacare.com, and it'll have all of our locations there.
AROSA,
Yes.
arosacare.com.
Yes.
All right, wonderful. Thank you both.
Thank
Thanks
you.
for having us.
Appreciate it.